an estimated 1 in 10 women have endometriosis. However, many are unaware that their symptoms of severe pelvic pain and irregular or heavy menstrual bleeding might be caused by this gynecological condition. With the guidance of patients, researchers, and clinical experts, the Society for Women's Health Research has designed a toolkit to assist individuals with endometriosis in navigating their care. Our Endometriosis Toolkit is a patient empowerment guide that provides easy-to-understand information and resources on menstrual health and stigma, understanding endometriosis, diagnosing and treating endometriosis, navigating endometriosis through the teenage years, pregnancy, and menopause, and managing a healthy lifestyle with endometriosis. This segment discusses diagnosing and treating endometriosis. Endometriosis is a chronic gynecological disease in which tissue similar to the lining of the uterus grows outside the uterus where it doesn't belong, leading to lesions, pelvic pain, and other symptoms. An estimated 200 million individuals worldwide are living with endometriosis. Although it is most commonly diagnosed in women in their 30s and 40s, endometriosis can begin in adolescence and can also affect postmenopausal women. Patients with endometriosis often face challenges on the path to diagnosis. Because of the stigma around menstruation, some women find it difficult or embarrassing to discuss period-related symptoms like pelvic pain and heavy bleeding with their healthcare provider. An estimated 3 out of 4 people with endometriosis will experience a misdiagnosis, and the average individual will see 3 or more doctors before they receive an accurate diagnosis of endometriosis. These delays can average more than 6.5 years between symptom onset and diagnosis. Open communication with your healthcare provider is the best way to ensure that you get a timely diagnosis. When endometrial tissue grows outside the uterus, it can lead to implants and cysts on pelvic organs. Some individuals may also have bands of fibrous scar tissue called adhesions. These implants, cysts, and adhesions can cause swelling, pain, and irritation to the surrounding healthy tissue. Endometriosis is officially diagnosed through a surgical procedure called a laparoscopy. This minimally invasive procedure allows your physician to view the organs inside your abdomen and take tissue samples for analysis. However, most experts agree that laparoscopy is not necessary to treat presumed endometriosis. More often, to diagnose endometriosis, your healthcare provider will ask you to describe your symptoms and may perform a pelvic exam or an imaging test, such as an ultrasound or MRI, to look for endometrial implants. However, these methods generally only find implants that have developed into large cysts. Preparing in advance for your healthcare appointments and advocating for your own health may help you overcome potential hurdles to diagnosing your condition. A doctor's visit worksheet is provided in the appendix of SWHR's Endometriosis Toolkit for you to fill out and take with you on your doctor's visit. You should be prepared to discuss your menstrual cycle and related symptoms, your record of fertility, family medical history, and past gynecological tests, treatments, or surgeries, and your current medications and other healthcare professionals you see. Researching and putting together a list of questions to ask your provider may help you feel more prepared to discuss your diagnosis and treatment. Questions may vary depending on whether you are being evaluated for the first time or receiving ongoing treatment, or if you're seeing a primary care physician, a gynecologist, or another specialist. Some example questions include: how can we determine if what I am experiencing is endometriosis or some other condition? Do I need a surgical diagnosis through laparoscopy? What treatment options are available? And what non-medical therapies and strategies may help with symptoms? Don't be afraid to restate what your doctor has told you or to ask clarifying questions to make sure you understand the answers. And remember to ask for additional helpful resources or support networks that you can access at home. There is no cure for endometriosis, but there are many options to manage the symptoms of this chronic disease. Options you can try on your own for pain relief include ibuprofen or Aleve, heating pads or a warm bath to help relax muscle tension and cramping, yoga, stretching, and regular low-impact exercise to help strengthen your pelvic area muscles. Rest, relaxation, and meditation to help reduce stress, or increase fiber in your diet to help minimize excess estrogen that can aggravate symptoms. Doctors may also prescribe muscle relaxants, antidepressants, or anticonvulsants in small doses to help treat pain. To prevent new lesions and to reduce pain, hormonal treatments can be used to regulate your body's natural hormone production and function. For example, contraceptives and progestin therapies reduce endometriosis pain by making periods lighter and shorter. These include birth control pills, patches, vaginal rings, and intrauterine devices. Gonadotropin-releasing hormone, also known as GnRH, receptor analogs, are man-made versions of the natural hormones that control estrogen to reduce the size of implants, pain, and bleeding. Danazol is a synthetic androgen that can be taken orally or vaginally to reduce pain by causing endometrial implants to shrink. Other types of treatment include pelvic floor physical therapy, nerve stimulation devices to treat pain in targeted areas, nerve blocks, which are local injections to numb specific pain regions at the nerve sources, muscle injections like botulinum toxin to treat pelvic muscle spasms and pain, and cognitive behavioral therapy to identify coping mechanisms to help reduce stress-aggravated pain. If your endometriosis symptoms are poorly controlled with medication and other forms of treatment, surgery to reduce lesions and scar tissue may be helpful. At one time, surgery to remove the uterus and sometimes the ovaries, called a hysterectomy, was considered the most effective treatment for endometriosis. However, experts are moving away from this approach and focusing on less invasive medical and surgical options. 65% of women with endometriosis report pain relief after surgery. However, 20 to 40% of patients experience new lesions within 5 years. So for patients with moderate to severe symptoms, surgery can be an appropriate but temporary fix because pain is likely to return over time. Here are some topics to discuss with your provider before committing to surgery as a treatment for your endometriosis. Which type of surgery they recommend, how long the procedure and recovery time will be, common complications, expected results or potential return of symptoms, and future impacts on fertility. When deciding on a treatment plan with your healthcare provider, you should discuss which treatments will address the endometriosis lesions and which will address your symptoms. Your treatment plan will likely include a combination of approaches and may change over time as your personal needs and goals evolve. Do not hesitate to seek a second opinion if you want another perspective on your diagnosis or treatment options. Factors to consider in determining your personalized treatment plan include your age, lifestyle and activity levels, goals for managing your symptoms, family planning goals, treatments you've tried or may want to revisit, how long you should wait before expecting to see positive results, and potential physical side effects like breakthrough bleeding or weight gain and loss, and emotional side effects like changes in mood. It's also important to find out the details of your health insurance coverage for the treatment options you want to pursue. Finally, ask your provider to outline a follow-up plan for monitoring your health and when to schedule future visits. For more information about endometriosis, or to download a copy of SWHR's Endometriosis Toolkit, a patient empowerment guide, visit our website, www.swhr.org. We also invite you to follow us on social media or sign up for a newsletter to get the latest in science, education, and policy concerning important women's health topics. The Society for Women's Health Research would like to thank everyone who contributed to the development of this toolkit, especially our Endometriosis Network, House Cat Creative Publishing, LLC, and programmatic sponsor AbbVie.